So did you know that your hormones can be influenced by inflammation or by the immune system? There's a crosstalk between these two systems in your body. Inflammation and the endocrine system are very closely interconnected in the human body. The endocrine system, of course, is the network of glands that produce and release hormones, which act as chemical messengers to regulate various bodily functions. Inflammation, again, is the biological response to harmful stimuli such as infections, tissue damage, or irritants like toxins. So these two systems interact in several ways. The endocrine system plays a key role in regulating the inflammatory response. So cortisol, which often gets a bad rap, is a hormone produced by the adrenal glands, and it is a very potent anti-inflammatory hormone. So it helps control and suppress inflammation by reducing the production of pro-inflammatory molecules called cytokines and prostaglandins. The endocrine system it works the other way as well because it responds to stress by releasing hormones like adrenaline and cortisol. So the stress response can trigger or exacerbate inflammation. Chronic stress, which leads to prolonged elevation of cortisol levels, may contribute to this chronic low-grade inflammation that's associated with various health problems. There's also a feedback loop. So hormones themselves can have feedback effects on the immune system and inflammation. For example, insulin, a hormone produced by the pancreas, has anti-inflammatory properties as well and can influence the inflammatory response. So understanding the relationship between inflammation and the endocrine system is essential for managing certain symptoms and conditions. And my question is, if your cortisol is high and you have inflammation, is there a reason that your cortisol is high? Do you want to take an adrenal supplement that's going to help lower cortisol levels when its purpose is to help control the inflammation? Or is the better idea to work with your body's wisdom and remove whatever is driving that inflammation, whether it be a toxin or you have a low-grade infection? That's what addressing root cause would look like, not treating the adrenals, because that's not the problem. The problem is the inflammatory response happening in response to your environment.